Good afternoon. My name is John Aaron Avalos, and I am a BSN nursing student at Indiana State University. This is my project for community health nursing. My population at risk is African Americans, diverse client groups from early teens through early 30s diagnosed or misdiagnosed with schizophrenia and the cultural and religious barriers to seeking help. The learning objectives. You will learn to define schizophrenia, the risk groups for schizophrenia, factors influencing the diagnosis or a misdiagnosis, identifying the signs and symptoms, knowing cultural stigmas surrounding schizophrenia and preventing help, and summarizing treatments. Please pause the video and click the link on YouTube to take a pre-test to see what you know already about schizophrenia. Schizophrenia is a serious mental disorder in which people's interpretation of reality is distorted. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia require lifelong treatment. Preliminary treatment may help get some symptoms under control before serious complications develop and may help improve the long-term outlook. Groups at risk. Although some difference by race or ethnicity has been reported, there are no racial differences in the population that has been diagnosed with schizophrenia. Indications from research shows that schizophrenia is diagnosed more frequently in Black people than in white people. This finding has been attributed to judgment by practitioners related to cultural assumptions. Studies over decades have shown that Black Americans are diagnosed at higher rates of schizophrenia than white Americans. In 2008, analysis of data from 52 different studies, researchers found that Black Americans are 2.4 more times likely to be diagnosed with schizophrenia. Other studies have shown that Blacks are diagnosed at 3 and 4 times the rate of white people. Factors influencing the diagnosis of schizophrenia. Diagnosis. You have to rule out other mental health disorders and determine that symptoms are not related to some substance abuse, medication, or a medical condition. Determining a diagnosis of schizophrenia may include a physical exam that rules out other problems that could be causing symptoms and to check for related complications. Tests and screening help rule out conditions with similar symptoms and screening for alcohol and drugs. The doctor may also request imaging studies such as an MRI or a CT scan. A psychiatric evaluation by a doctor or a mental health professional checks mental status by observing appearance and demeanor and asking about thoughts, moods, delusions, hallucinations, substance abuse, and potential for violence or suicide. This also includes discussion of family and personal history. You can also do a diagnostic criteria for schizophrenia, which is conducted by a doctor or a mental health professional, and they use criteria in the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association. Misdiagnosis, how personal values and beliefs can impact care delivery to diverse client groups. African Americans with severe depression are more likely to be misdiagnosed as having schizophrenia, according to Rutgers. The Rutgers study looked at 599 Blacks and 1,058 non-Latino whites, found that clinicians failed to properly weigh mood symptoms when diagnosing schizophrenia among African Americans or other diverse client groups, suggesting that racial bias, whether conscious or subconscious, is one factor in the diagnosis of schizophrenia. Misdiagnosis. Clinicians who evaluate African American or diverse client group patients should question old diagnoses over 20 years ago. Alcohol or alcohol withdrawal may mimic the hallucinations and agitation of an acute psychotic episode. If previous evaluating clinicians did not explore the substance abuse history of the Black patient, the role of alcohol in the formulation of symptoms may have been missed. On the other hand, overactive or excited behavior for a few days may have been ignored due to the diagnostic bias of the clinician, resulting in a diagnosis of schizophrenia rather than the correct diagnosis of bipolar disorder. African Americans have a prevalence of isolated deep sleep paralysis of approximately 41%. African Americans who have frequent episodes of isolated sleep paralysis were found to be more likely to have panic disorder. These findings suggest that the evaluating clinician should explore with African American patients the criteria for symptoms of these disorders during the initial evaluation sessions. Consequences of misdiagnosis. Inaccurate diagnosis can have grave consequences. Mood disorder treatments are different from those for schizophrenia, and the outcome for these conditions is more positive than for schizophrenia. Patients who may have major depression with psychotic features or bipolar disorder and who are misdiagnosed with schizophrenia do not receive the designated treatment, putting them at risk for advancing the underlying disease process or for suicide. Also, the side effects of medication taken for schizophrenia, such as diabetes and weight gain, can be very serious. The solution: you must educate the practitioner and integrate cultural differences, values, preferences into properly diagnosing the patient based on ruling out racial bias, substance abuse, medication, or a medical condition. Signs and symptoms of schizophrenia. Delusions, hallucinations. Signs and symptoms. Disorganized thinking, extremely disorganized or abnormal motor behavior, and negative symptoms. Also, symptoms in teenagers. Schizophrenia symptoms in teenagers are similar to those in adults, but the condition may be more difficult to recognize. This is because some of the early symptoms of schizophrenia in teenagers are common for typical development during the teen years, such as withdrawal from friends and family, a drop in performance at school, trouble sleeping, irritability or depressed mood, and a lack of motivation. Also, recreational substance abuse, such as marijuana, methamphetamines, or LSD, can sometimes cause similar symptoms and signs. Cultural stigmas and barriers surrounding schizophrenia. Refugees from a developing country, there is often a belief that mental illness is caused by supernatural forces or that the person is possessed. This background tends to seek a religious healer and shun science. People with a Christian upbringing are more likely to go to a priest than a psychiatrist. Sufferers believe that they are a saint, a prophet, or God himself. Or in women, that they are a saint or are pregnant with the Messiah. Sometimes the person may believe that they are being punished for some unforgivable sin that they have committed earlier in their life, or that they are damned to everlasting hell. This can lead to feelings of intense loss of hope. In other cases, the sufferer may believe that the others around them are devils or witches and may attack them, or that they themselves are possessed by the devil. Cultural stigmas again. In the Indian culture, they are considered a spirit medium who is the human incarnation of a Hindu god. African culture, hallucinations are not necessarily seen as a sign of mental illness. Shamans, tribal priests, who act as intermediaries between the natural and spiritual worlds, are deeply respected for their ability to describe their experiences in the supernatural realm. American Indian culture. Many tribal societies regard the spirit world as immediate and accessible and believe that they can communicate with their deceased ancestors. These beliefs reflect cultural norms and are not considered delusions. In the Asian cultural, spiritual, or supernatural phenomenon. All of these cultural stigmas prevent people from seeking help. Barriers. Disease prevention at the individual and population level. Lack of awareness, stigma, and fear. Delayed diagnosis. Resistance. Public stigma. 39% of people would be embarrassed to tell others if a person in their family had schizophrenia. 28% would not tell their friends if they had schizophrenia. 7% believe the best way to help people with schizophrenia is to remove them from society. 33% believe people with schizophrenia cannot move from treatment to full recovery. 32% feel uncomfortable in the presence of someone with schizophrenia, and 40% feel that avoiding a person with schizophrenia is not a form of discrimination. Culturally sensitive health promotion must be done. Awareness, avoid making assumptions, learn about other cultures, build trust and support, overcome language barriers, educate patients about medical practices, practice active listening. Culturally sensitive health promotion and treatments for schizophrenia. Medications such as antipsychotics, mood stabilizers, and antidepressants. Individual therapy, cognitive behavioral therapy, social skills training. Treatments improve population health, wellness, and the promotion of healthy lifestyles. Behavioral family therapy, vocational rehabilitation and supported employment, community support programs, hospitalization, and electroconvulsive therapy. Here are some additional resources on schizophrenia. Please pause the video and click the link in YouTube for a post-test to see what you have learned. Here are some additional references. Thank you very much for listening to my presentation.